Okay, welcome back. So when we touched on biofeedback and showed you some of the activity, how to control those Kegels and do exercises and what it does to the bladder, we talked a little bit about bladder functioning. So here's a picture. I'm just going to give you a brief view of micturition, which is basically emptying of the urinary bladder. So most people don't know that the bladder is innervated by two different neurological symptoms. One will actually squeeze the bottom of the bladder, and that then gives a signal to the top half of the bladder to relax. And then when you squeeze muscles on the top, you give a contraction to the top half of the bladder, and that tells the bottom part of the bladder to relax. And that contracts and that's emptying. That's what causes emptying of the bladder. So what happens again in overactive bladder is that bladder is spasming for some reason, and it's sending a signal right away. It gives you a sense of urgency that you have to empty your bladder. Some people even experience this on a half full bladder. One of the other treatments that we're able to provide in-house with our biofeedback machine is e-stim, where we can send a signal to the bladder to cause it to relax. So that's just a brief overview of kind of how the bladder works. Again, if you're able to do that Kegel correctly, when you squeeze those muscles, it gives a signal to the bottom of the bladder, that then triggers the top half of the bladder to relax and stop spasming. If you're controlling constipation, if you learn some exercises for strengthening of the pelvic floor, all of those things can help you with overactive bladder. But there are treatments that aren't medication, that aren't drugs, that aren't surgery. So if you have any questions, IM us, give us a call. We'll be glad to help you.